Hello, and welcome to another day of Living with Spina Bifida. Today is Mental Health Monday, and I am going to be covering the topic of depression. Clinical depression is a medical condition that goes far beyond everyday sadness because everyone that has ever been a human, everyone that has ever experienced life, has experienced sadness and down times in their life. But when you have actual depression, it goes far beyond just being a little down. It causes profound, long-lasting symptoms and often disrupts a person's ability to perform everyday routine tasks. A person's vulnerability to developing this disorder is often related to many factors, including changes in brain function, genetics, and life stresses and circumstances. Depression is the most common psychiatric disorder worldwide. In the United States alone, 17% of the population experience clinical depression sometime in their life. Even so, very few people discuss their symptoms and their issues with their healthcare provider because there is a lot of stigma that comes with mental health issues, and a lot of people are ashamed of having problems and they don't want to be labeled as crazy, so they just try to ignore their issues and deal with it on their own without accepting help from medication or even a doctor. And a lot of times people will go into their doctor complaining of physical symptoms such as headache, back pain, or chronic pain, when a lot of times those issues are related to depression. Like I said, people are often reluctant to talk to their doctor about their mental health issues because of the stigma and negativity towards mental health. And they see their depression as a personal weakness rather than an actual mental illness that they cannot prevent and cannot help that they have. And the problem there is effective treatments do exist, and not treating depression can cause serious problems. People with untreated depression have a lower quality of life, higher risk of suicide, and worse physical prognosis if they have any medical conditions besides depression. In fact, people with depression are almost twice as likely to die as people without depression. What are the symptoms of depression? Depression can take many forms and have varying levels of severity. Part of the variability in the disorder happens because it can co-occur with many other mental illnesses, which can shape the manifestation of depression. When people talk about clinical depression, they're usually referring to what healthcare providers call unipolar major depression or major depressive disorder. To be diagnosed with unipolar major depression, a person must have 5 or more of the following symptoms present most of the day, nearly every day, for at least 2 consecutive weeks. For the diagnosis, at least one symptom must be either depressed mood or loss of interest or pleasure. Depressed mood, people with depression tend to feel sad, hopeless, discouraged, blue, or down in the dumps. Sometimes they don't even realize that they are down, and they say that they often feel anxious, blah, or have no feelings. Plus, some people with depression feel annoyed, frustrated, irritable, or angry. Loss of interest or pleasure in most or all activities. People with depression are no longer as interested in or feel as much pleasure doing the things they used to enjoy. Hobbies and activities lose their appeal, and depressed people say they don't care anymore. They may withdraw from or lose interest in friends, and they may even lose interest in sex. Changes in appetite or weight. Appetite and weight can either increase or decrease as part of depression. Some people have to force themselves to eat, while others eat more and sometimes crave specific foods, such as junk food and carbohydrates. Insomnia or hypersomnia, sleeping too little or too much. Depression often disrupts sleep patterns, leading people to either sleep too much or be unable to fall asleep or stay asleep. Even when they do sleep, people with depression often say and have a hard time getting out of bed in the morning. Restlessness or sluggishness. People with depression can feel agitated and restless, or have the opposite effect and feel slowed down. Agitation can manifest as hand-wringing, pacing, and fidgeting, while sluggishness can manifest as a slowing of body movements, thinking, or speech. Fatigue or loss of energy. People with depression often feel exhausted and listless. They sometimes need to rest during the day or even feel as though their arms and legs are weighted down. Plus, they have trouble starting or completing tasks. Feelings of worthlessness or excessive guilt. People with depression can feel inadequate, inferior, worthless, or like a failure. They often carry tremendous guilt about this. Often, this leads them to misinterpret neutral events or minor setbacks as evidence of personal failure. Poor concentration. Some people with depression have trouble thinking clearly, concentrating, or making decisions. They can also be easily distracted or complain about memory problems. Recurrent thoughts of death or suicide. People who are depressed can experience recurrent thoughts of death or suicide and may attempt suicide. Suicidal ideation can be passive, meaning the person thinks simply that life is not worth living. But they can also be active, meaning the person actively wants to die or commit suicide. People with active suicidal ideation are severely ill. Some people with depression hurt themselves, for example, by superficially cutting or burning their skin. They do it to relieve pain that they are feeling within themselves, and they expect the injury to be minor, meaning they don't actually want to die, they just want the pain to stop inside them. But even though it is non-suicidal self-injury, it is still very serious, and that person is still severely depressed. There is depression with mixed features. This is the term for depression that is accompanied by some manic symptoms, but not enough to diagnose someone with bipolar disorder. A person with this type of depression might do something like talk much more than usual, have extra energy, sleep less, or have episodes of seeming unusually happy or excited. Anxious depression. The most prevalent symptoms of anxious depression include worrying, pacing, and other manifestations of anxiety. Situation-specific depression. For example, women develop depression just before or after giving birth, or just before they start their period. And as I have talked about before, there is seasonal affective disorder. Depression can occur on its own, but it often occurs with other psychiatric disorders or medical disorders, such as spina bifida. And spina bifida and depression seem to go hand in hand quite often. And it can also co-occur with other medical problems, such as diabetes, heart disease, cancer, and many others. But the relationship between depression and medical issues is very complicated. Among the psychiatric conditions that can co-occur with depression are anxiety, post-traumatic stress disorder, obsessive compulsive disorder, attention deficit hyperactivity disorder, substance abuse, avoidant or borderline personality disorder. If your healthcare provider suspects that you could have depression, they will ask about your symptoms and state of mind. The most important information will come from your description of your illness and being open and honest and unafraid to get the help that you greatly need. Because if you have clinical depression, you can't fight this alone. You need help from others. You need support from your family, your friends, from your doctor, from a psychiatrist, and if need be, medication. If you don't have depression and you are looking at someone with depression, it can seem like they are just lazy. They are unmotivated. You could even think, oh, they just need to suck it up and get over it, because everyone has problems. Everyone has bad days. That is true. Like I said before, if you are a human being with human thoughts and emotions, you do get sad. You do get down. You do have problems that surface because of life. But if you have actual depression, it's not even close to as simple as just sucking it up, getting over it, making yourself live life and be happy. Because there is something in your brain that is not allowing you to live life correctly. So if you are someone that does not have depression, but you know someone who does, the best thing you can do for them is just be there for them. Whether it be stopping by for a visit, bringing them some treats, some soup, a gift, just being there, giving them your presence as a present, or just lending them an ear or a shoulder to lean on, being a support net for someone that so greatly needs it, and leaving ignorance and judgment at the door. And if you feel you need to give them advice, leave. Everyone has problems. Other people have it worse. And, leave all of that kind of talk at the door, because it's not going to help. Because they don't want to feel this way. If they could stop feeling this way, they would in an instant. But something inside them is not letting them feel right. So the best thing that someone without depression can do for someone with depression is just be their rock. Be their support net. Be their friend. Be their family. Be what they need. It could be as easy as asking, what do you need from me? I want to help you as best as I can. What can I do for you? And maybe they don't know themselves what you can do. So maybe you can do a little digging and find something for them that no one would have thought of before. And if you are someone with depression, I myself am someone with depression. And it's okay. There is nothing wrong with me except the fact that I have depression. I'm not a bad person because I have depression. It's not something to be ashamed of. It's just something that happened and something I need help with. And it's something that happened to you and something that you need help with. Ignoring it, denying it, being ashamed of it will not help you. Yes, I will always have depression. It will always linger. It will always be there. It will kick me down when I'm least expecting it, and other days it will bring me up when I am least expecting it. But I have to accept that it is what it is, and I am here with depression, and I need to see my doctor regularly. I need to take my medication daily, and when I feel I need a little extra help from others, I need to ask for it, I need to accept it, and I need to reach out to others. And the same goes to other people with depression. If you are new to this, if you are just waking up to the fact that you could have depression and you have not sought out help, just remember, you are not alone. I am here. So many other people are here. And all we can do is keep on moving. And if you ever need someone to be there for you, I can be that someone. Just remember, you did nothing wrong. It is okay. What is not okay is just ignoring it and hoping it'll go away. Because mental illnesses don't just go away. They get easier if you find the correct treatment, but you have to reach out for that treatment first. And just remember, just because you have depression does not mean you are less than, does not mean you can't be loved, cared for. It just means you need a little extra boost.